I lived in Country Village for a long time, and we never had a doctor in here, and I always had to try to make a way to get to the doctor. So this means a lot to me because I don't have transportation.
I was blessed to be able to be accepted by Dr. Donald Lee. And he's not only a doctor, he's a friend.
I live in Country Village and I love it. And since Dr. Lee's been here, I love it even more because it's so convenient.
My name is Sharon Lambeth and I am the Regional Property Manager at Country Village Apartments. We embrace the idea of a doctor in our community because many of our residents do not drive, so it's difficult for them to see a physician. To be able to receive quality care without leaving the premises provides a service that few communities offer. In addition to the convenience factor, our residents have a warm and compassionate doctor and staff who truly care about them.
I'm 78, so he keeps a close eye on blood pressures and things like this. And he'll let you know right up front what's going on. There's none of this, I like a doctor like that. He doesn't hold back. He'll tell you, this is it. Pay attention. I like a man like that.
My name is Dr. Donald Lee. I've been in the Country Village Clinic here for about a little over a year now, and we have been servicing mostly the indigent senior populations, which has been a perfect practice for us being an internist and taking care of the patient's needs. And the majority of patients have been here have been neglected in some ways for their medical care, or they could not get any transportation for their services. And having this clinic inside their senior community means tremendous help for the care they are able to receive. This goes back to about 14 or 15 years ago when I started practicing in Temecula. And my patients has been long-term patient of mine, majority seniors, and they start having difficulty coming to see me. And that's what gave me an idea of how can I pay back or care that I can give to them.
Dr. Lee and I have been seeing senior patients in the office together for many years, and one of the problems that we noticed was that a lot of the senior patients wouldn't come back for their follow-ups because they just couldn't. There's so much involved with patients who have either dementia or arthritis to be able to get them out of bed, into a vehicle and into the office. And it's really sad to see when patients don't get the proper care that they need simply because they can't make it from their room to the doctor's office.
Giving me the idea to open up a clinic inside the community to service their residents, and so that they don't have to transport themselves or their loved ones, which is a very busy schedule, to making arrangement to come to see the doctor.
Hi, I'm Richard Ortiz, physical therapist with ATS. I work along with Donna Onzai, an occupational therapist, in developing programs for Dr. Lee's group. Dr. Lee has a team of the best in the area: nurses, physical therapy, home health, pharmacy, and medical services offered to senior resident centers, RCFEs, and board and cares. We deliver on-site services and are constantly refining our product to meet the needs of our customers in the specific healthcare area. We also perform what we call an indemnification program, where we ensure that the owners and management of the RCFEs have a safe environment. We assess all the patients and all the durable medical equipment in the facility to make sure it's compliant with regulatory standards, and certainly safe and effective for the patient. We also have an Americans with Disability consulting services to make sure that their grounds are safe and provide total access for their residents.
Most of our patients and the family members are really surprised with the number of services we're able to do in these facilities. We're able to draw blood, we can do ear lavages, many suturing and wound procedures can be done right in our office. So often the patients will be able to receive excellent medical care and never have to leave their facility.
Yes, it's always been a great emotional treating and dealing with the senior patients, and by all means, that's all the patients. We do have a wonderful relationship, and that's what I like to do, is being very personal to the individual patients, and not just be a number but it is a sharing the emotional and able to give not just the physical well-being, but also the spiritual well-being.
I don't have a car, I just have a golf cart, which brings me right over to his office. And he's just a wonderful person. He has personality, he's easy to talk to, he explains things very well to you. Any questions you want to ask, he's right there to answer them for you. And what more could you want?
Because Dr. Lee is not your average doctor, he is atypical in that he cares about the residents, and he demonstrates that. He takes a lot of time with them, he listens, he tries to figure out what's wrong, and he sends them to a specialist if that's what it takes, and they're able to get most of their health care without leaving the premises. And they're part of us, and our residents know that, and we're able to talk to future residents about how he is more than just a doctor. He is a part of us.
We are really happy to have this medical group here with us because we are in need of it. We're thanking Dr. Lee and his group for all the services that he's offered to us and all the medical seminars and things that we really are interested in that pertain to us as seniors.
We're just trying to be a part of the team. I mean, that's what we're trying to do. It's not just this is a separate the clinic. We want to be part of the resident, the community. That's the role that we want to play.
We are grateful for the grace of God that we have this man here. I can't thank him enough. Thank you isn't enough.
And I'm just very grateful he's here. He's a good doctor.
I think this is a godsend, I really do. That's what I can say about it.